Welcome to our talk show Harnessing Hormones, in which we are going to speak about endocrine system balance and how to balance your blood sugar levels. And we have with us a very expert speaker. Her name is Ms. Rupal Shah, and she is a certified diabetes educator, a sports nutritionist, a writer, and also a public speaker. And she has been working in the field of nutrition and dietetics since last 10 years. Welcome to the talk show, Rupal.
Thank you so much for having me here, Shweta, and for the wonderful introduction too.
Yes, it's my pleasure. It's an absolute pleasure to have you today on the talk show. So first of all, let's start by speaking about endocrine system. What is endocrine system and what role does it play in our body?
Surely. So just as we have cardiovascular system which deals with the heart functioning, we have cerebrovascular system which deals with the brain functions. We have an endocrine system in our body too, which basically deals with endocrine glands that produces, stores and releases hormones. So hormones are nothing but the chemical messengers. So with hormones, a little bit just go a long way. So just a minor fluctuation in hormones can lead to symptoms like high blood sugars, weight gain or weight loss. It can be infertility or mood swings, or it can be depression. So it's like it has a huge number of symptoms, hair loss, so depending on which endocrine gland is affected, the symptoms accordingly is what we see.
Okay, so what are the classical symptoms that you see when it comes to endocrine system health?
Sure. So basically when you see, for example, let's take a common example like diabetes. So diabetes is a condition which we see when pancreas as an endocrine gland is affected. It stops or it decreases the production of insulin, and that is when you see the sugar spike.
Exactly.
The same ways when pituitary gland is affected. Pituitary gland is responsible for releasing growth hormone, and when pituitary gland is affected, we see either the child is growing too much or growing too little. Similarly, if thyroid gland is affected, we see either that person is having hypothyroidism, where the thyroid hormones are released in a lesser number, or it can be hyperthyroidism. So this is, based on which gland is affected, that particular hormone release will be affected, and based on that we will see the number of changes in our body. It can be ranging from hair fall to mood swings to body pain, low metabolism, and it's like it has a huge array of symptoms that we see.
Okay, so if you see any of the changes like a lot of hair fall, fluctuation in body weight, difficulty losing weight, a deficiency of focus or deficiency of mental acuity and sharpness, do consider your endocrinologist, because I think these are very classical symptoms of endocrine system imbalance that we see today. So Rupal, as you said that every hormone has a different function. So can you tell me more about how do hormones actually function in the body?
Sure. So Shweta, basically hormones think of these hormones as a lock and key mechanism. So hormones are like the keys, and the target sites where the hormones is going to act have a specialized lock.
Okay.
So each of the hormone is a specialized key, and the receptor target site have a specialized lock. So hormones, when they are released from endocrine glands, are into the blood system, and whenever they fit into that target cell, that is where they start producing the action.
So I think it's amazing the way you explained the lock and key mechanism. So can you give me some examples of lock and key mechanism, like some of the hormones?
Sure. So if we consider again a common disease like diabetes, so insulin is a hormone, and the target site is muscles.
Okay.
So when insulin is released into the blood system, and when the muscle have that receptor, muscle is a receptor, and when muscle have that lock, what happens is insulin goes and fit that muscle, and that is when the muscle starts utilizing the excess blood sugar and starts storing it. And that is the reason why in normal individuals we will never see a blood sugar spike. But when it is a case of a person who is suffering with diabetes, we see there is not enough of insulin in the blood, and that is the reason we see that blood sugar conversion is not happening. The muscles are not getting enough of energy or the blood glucose.
Okay, so we can say insulin is like the key and
Exactly.
muscles are like the lock. So that's wonderfully explained. So can you tell us some of the, so we see a lot of hormonal imbalance today, a lot of people suffering from endocrine imbalance and things like that. So what are the diet and lifestyle changes that we can have so that we can manage our blood glucose levels, and also we can manage the overall endocrine system health? That means we are managing overall hormones. So in the umbrella, we can cover whole endocrine system, and can you tell us some tips and tricks to balance that?
Sure. So when it comes to managing endocrine functions and managing hormonal balance, you need to understand one thing. It's a holistic approach that we will have to take. It's not just one thing. So holistic approach will be inclusive of healthy eating as well as exercise, good right quantity of physical activity as well as the quality of physical activity, as in it needs to be a combination of cardio as well as the weightlifting. Also, it will include how you are managing the stress level, because that is inevitable, but we need to learn how we are managing it. Also, it will include the good sound sleep, whether a person is getting it or not. So when all these factors are corrected, that is when you will see the actual hormonal balance is working in your body. Also, you will be able to see there is no endocrine dysfunction that is happening.
Yeah,